It's very interesting the way George Levicki and I first decided we should think about an oral health curriculum.
We had spoken about doing something for Virginia Tech shortly after the massacre. And as we talked about it, we really wanted to do something that was health related and oral health related as well.
And they just wanted some way to honor the school. They thought that the fact that a new medical school was coming on might be the ticket.
I had not met the dean previously, but I did know Buddy Conklin, Dr. Conklin. And so I called Buddy up and said, told him what we were thinking about doing.
I had Dr. Johnson in the dental chair. And I said to her, hey, you ought to think about putting an oral health curriculum into the medical school. And she said, I thought about that.
So the idea kind of surfaced in one of our board meetings that perhaps we should consider providing some education to physicians about oral health.
And then I'm out in Montana fishing. Bruce Johnson, Dr. Bruce Johnson calls me on the telephone. He said, Cinda and George Levicki have met and it looks like we're on. And so out of a group of visionaries, that was sort of our starting point.
Then we began looking at what would be funded, and that resulted in our first two gifts of an endowment for a lectureship and then money to start the actual curriculum.
Everybody came together and decided it was worth trying to put into our program, and our program is so flexible that we were able to not only just put it here and there, but we were able to carve out an entire week that we could then really focus down on the breadth and depth of oral health as much as we can for our medical students.
Two things were important for us. One, we wanted to make sure that the students learned the entire lifespan and the changes, including the pediatric oral health exam. And two, we wanted to make sure that the traditional kind of head and neck exam included a complete exam of the mouth.
This is my 37th year at the hospital. And up until that time, I was amazed at how little physicians understood about the mouth or even examined the mouth.
The joke that Dr. Conklin always makes is that, most doctors, when they look in the mouth, they're looking straight to the back of the mouth. Dr. Conklin kind of reiterated over and over again that if you aren't looking at it, maybe no one else is either.
We want the students to understand the foundational anatomy and structure of the oral cavity, be able to recognize the importance that this is part of the physical exam that needs to be included.
Over the years, we've seen any number of studies starting to propose a connection between oral health and certain medical diseases.
When they're younger, many of the kids, young adults, will see a dentist. As they age, it's less likely that they will do so, and their encounters with a medical professional is typically with their physician.
We have students who will then become physicians that are keeping this aspect of medicine at the forefront of their practice and including it. I think patients will be better for that.
For me, since I am interested in rural family health, and at least the population that I grew up around, there's a lot of heavy tobacco use, not just cigarette smoking, but also dip, chew, so oral tobacco use. So that has a tendency to cause mouth cancers, and so it's something that you need to be looking out for as their provider.
There are going to be patients out there who are going to be diagnosed early, cured of their disease, because the students went through this curriculum, they're aware of it, and they're applying clinically. That means more time with grandchildren and quality of life and so on. So that's what I see as the end zone and the most important part of the curriculum.
It has been clear from the beginning that we really do have the market on a unique program.
Matter of fact, we're unique enough that the American Dental Association even wrote this up in their 88 newsletter and commented on how pleased they were to see this type of education taking place.
We presented some of this curriculum, and we had some dentists and dental educators in the audience, and they were just amazed, and they were saying things like, you all do more for oral health than some medical schools that actually have dental schools attached to them.
They were so excited about what we had to say that they really told us they just dreamed of having partner medical schools that could do the same.
I've gotten calls as far away as Australia They're talking about what's going on at the School of Medicine here, what we've done with oral health, putting it back into medical education. The word is spreading. We're proud of what we've done, and we're so thankful for Delta Dental and George Levicki's leadership in allowing us to accomplish this.
Dr. Levicki was very, very instrumental in getting this started.
Every way you look at it, this has been a wonderful partnership, and we hope that we have given back in the same measure that he has given to us.